So yes, welcome to the session today. So here we are going to describe the muscles of mastication and the whole detail of it, the origin, insertion, the nerve supply and the action of the four primary muscle involved in the masticatory process. And before starting the session, I would like to give you the brief introduction about myself and the platform. Myself, Dr. Monalisa, and I'm an educator of anatomy subject on the platform of Unacademy. This is my referral code ANAT10, which can be used by you if you want to take the plus subscription of Unacademy or you want to see the free sessions on the Unacademy platform. So free live sessions on the Unacademy NEET PG platform, you can use this code ANAT10 and you can unlock the free sessions of any subject on the Unacademy platform. So these are the schedule for this month of June. So yes, I am here for like 7:30 p.m. is the timing where we get the MCQ session I take. So today also in the evening 7:30 p.m. exactly on the YouTube channel Let's Crack NEET PG, I am coming up with the session of continuation of the high yield anatomy MCQ session. The same anatomy high yield MCQ discussion will be taking place on 9 p.m. session also on the Unacademy platform. So there also we will have the session. Conceptual anatomy 6 p.m. session is there, but so I think I will start from not today, day after today means tomorrow I will start the session, this one. Again, any of the session you want to be the part of this session on the Unacademy platform, the code can be used as ANAT10. These are the sessions of mine. So today is 8th June and 9 p.m. session is the anatomy high yield MCQ session. This is so this is on the Unacademy platform, and 7:30 timing is the timing for the anatomy MCQ discussion on the YouTube channel Let's Crack NEET PG. Okay. So iconic subscription, I would also like to give you a brief about the iconic subscription of Unacademy, where merging of Prep Ladder and the Unacademy has been done. So what does this mean? This means the benefit of both the platform can be utilized by you. So you can be the you can see the live sessions, no doubt about that, be the part of the live sessions. Okay. Srija, ma'am, what's the price of plus subscription? Srijal Mishra, yes dear, I will just give you that details also, just wait. Okay Srijal, that slide is also coming up. Okay. So yes, these benefits will be taken by you, and boost your preparation by taking 3 months of subscription and getting 1 month of subscription absolutely free. Boost your preparation by taking 12 months of subscription and getting 2 months absolutely free. Download the Unacademy app, use the code ANAT10 for 10% discount. So you will get 10% discount. And Srija, these are the details. Either you can take 1 month of subscription, this is the detail 4,500, or you can take 6,000, 12 month, 36 month, 34, 24. So this is a slide where you can take the picture of this slide, screenshot, and this is the code which can be used by you. I also want to tell any confusion, so be free to see the sessions, and there is all details given. So okay Srija Mishra, this is the detail of all the subscription of iconic and plus subscription. Okay. So this is the detail of the iconic plus subscription, and this is for the other details. So whichever suits you, whether the iconic or only the plus subscription, this is for plus subscription, and this is the merging of Prep Ladder and that of Unacademy both. So whichever suits you, whichever month, whether, so for iconic is the 12 months, 18 months, 24 months, 36 months. So whichever suits you, you can take, and all the 19 subjects will be covered up along with PDF notes. All the recorded version, 34,000 MCQs will be there. So these are the benefits. What are the benefits of taking plus subscription? Okay, live sessions, you can be the part of live sessions, you can be the part of weekly test, you can be the part of structured course, unlimited access is there. Okay, and these are the ongoing sessions. NEET PG session is going on. Okay, target next 2022. So if you have got time and you are going to appear for 22 or 23, means 2-3 years is there, then you can go for target next sessions. MBBS professional second year batch is also going on. So batch courses are also there. Many courses are simultaneously going on. So whichever suits you, you can be the part. The other plus point of the plus subscription of Unacademy is that it is not that you are targeted for one session. If you have got time, you can be the part of several sessions at the same time. Okay. So that is the benefit. Is it okay, Srijal Mishra? And and this is my Monalisa Anatomy. So, Srijal Mesra, this is my Telegram group. You can be the part of this Monalisa Anatomy. This is the Telegram group link. So, you can be the part of this session and you can ask your anatomy related doubt. You can follow me on the Unacademy platform for any updates related to the classes, your anatomy sessions, your doubts. So, all these informations are there. So, you can join this group Monalisa Anatomy. So, can we start with the session now? So, let's start with the session now. Muscles of mastication. Okay, so let's start with the session now. So yes, actually when we talk about this list of muscles, we have to today I am targeting, and what is very important that we should know in detail is the primary muscles of mastication. There is also accessory muscles of mastication, that is digastric, mylohyoid, geniohyoid and buccinator, but we will concentrate on the primary muscles of mastication in more detail. Sorry. So, please write on the list. Primary muscles of mastications are following: temporalis, masseter, lateral pterygoid, medial pterygoid. Okay, this is the primary muscles of mastication. When we talk about secondary muscles, so accessory muscle, you can say accessory muscles are digastric, buccinator, mylohyoid, geniohyoid. Got it? This is the list of the muscle, accessory and the primary. So, this is the list of the muscle, accessory and the primary. Got it, everyone? So, let's discuss the muscle one by one. So, firstly I would like to show you this diagram where you can see the important primary muscles of mastication. So, this is the 4 muscle which is very important, and it often has been twisted like an image based question, and MCQs has been targeted from this point. So, it is important that you should know the origin, insertion of these muscles in detail, and you should also know about its nerve supply and action, which is quite important. So, you can't leave this topic. So, 4 muscle in this category: temporalis, masseter, medial pterygoid and lateral pterygoid. So, one by one the details of individual muscle. Okay. So, let's start with the first muscle in this category, that is the temporalis muscle. So, my dear friends, in this diagram you can clearly see this is the temporalis muscle. Okay, this is the temporalis muscle, and it's like more or less it's fan shaped. If you will, you can see these are the fibers of temporalis muscle, and these this is a fan shaped muscle, and it's covering the temporal region. When we are seeing the skull from the lateral aspect or lateral view, you can see the whole of the temporal area above this ear. This whole area is covered by the temporalis muscle. Okay. So, if we talk about the origin, it is from the whole of the temporal floor except the part which is formed by the zygomatic bone, and also from the deep fascia of the temporal fascia. So, and when you will see the insertion, it will go towards the coronoid process. So, let me show you that it's all fibers are there, they will converge and get inserted into the coronoid process of mandible. So, let me show you that diagram. So, is it clear? So, I am just, yeah. So, this is whole the temporalis muscle, and you can see it is passing onto the lateral aspect of the skull behind the zygomatic arch. So, this is the zygomatic arch. So, it is just passing behind or posterior to zygomatic arch, and it condenses here, and it is inserting into the coronoid process of mandible. Where it is inserting? This part which you are seeing, this part which you are seeing there, this is the coronoid process of mandible bone. Okay, this is the coronoid process of mandible bone. So, is it clear, origin, insertion, everyone? Okay, so let's write the detail of it. Temporalis muscle. Temporalis muscle. So when we talk about origin of temporalis muscle, it originates from whole temporal fossa, whole floor of temporal fossa except the part formed by zygomatic bone, except the part formed by zygomatic bone. Okay, except the part formed by zygomatic bone. Now let's discuss about the insertion. So when we talk about the insertion, it inserts on, so we will see the fibers of actually temporalis muscle, you can see it's a fan shaped muscle, so its fibers converges. So it converges to form a tendon, and this converged tendon will passes in between the gap of zygomatic arch and the side of the skull. So it passes in between the gap formed by zygomatic arch and sides of skull. So it is converging, and thereafter it will pass lower down and get attached to the medial apex and the anterior border of coronoid process of the mandible, which we have seen in this diagram also. So if you want, you can write here itself the insertion point. So thereafter it is inserting exactly as shown in the diagram also. It inserts into medial surface, also onto the apex and anterior border of coronoid process of mandible bone. Also few fibers are attached onto the anterior border of ramus of the mandible. So also few fibers attach onto the anterior border of ramus of mandible. Okay. So few fibers are also attached to the anterior aspect of ramus of mandible till the level of last molar tooth. So it goes till the level of last molar tooths. Okay. So yes. So in short, we have done with the origin, insertion. Now moving with the nerve supply and action of temporalis muscle. So let's write more about the details. So it's important that all these four muscle, origin, insertion, action and nerve supply, is to be known by you. So let's discuss about its nerve supply and action. Actually, there are some of the characteristic feature which is quite similar to the muscles of mastication. All the muscles of mastication is having the similar nerve supply from mandibular nerve, branch of trigeminal nerve, and also they are supplying the muscle which is originating from first pharyngeal arch, and they are all located in and around infratemporal region, infratemporal fossa. So nerve supply, when we talk about the nerve supply of the muscle, it is from deep temporal nerves. It's from deep temporal branch of, so deep temporal nerve is actually a branch of anterior division of mandibular nerve, branch of anterior division of mandibular nerve. What about others? So this is the nerve. Now moving on to the action of the muscle. So when we talk about the action of the muscle, what is it is causing? It is causing elevation of the mandible. Temporalis muscle is causing elevation of the mandible and closes the mouth. But if we talk about its posterior fibers, actually temporalis muscle has got three fibers, anterior, posterior and intermediate fibers, and the direction of anterior fibers is oriented vertically. the posterior fibers are oriented horizontally and the intermediate fibers are in oblique direction. So, action, it elevates the mandible, that means closing the mouth, and its posterior fibers of temporalis bone retracts the mandible. Temporalis muscle retracts the mandible. It is retracting the mandible. So, yes. Any doubt you can ask me. So, I also want to, okay. So, yes. Let me enlarge this diagram. So, few fibers I want to describe. So, firstly rub this, yeah. So, what I told you, it is having anterior fibers, intermediate and that of posterior fibers. So, here this is the outline of whole of the temporalis muscle, and I just want to tell that this whole muscle is fan shaped. Temporalis muscle as a whole is a fan shaped muscle morphologically, and we can categorize as few fibers which is straight down, going straight down like this. So, these are the anterior fibers. So, anterior fibers are vertical, the fibers of anterior fibers are vertical in direction, the posterior fibers are more of horizontal in direction, okay, and the middle fibers, when we talk about the middle fibers, they are oblique in direction, So, this is posterior fibers, this is middle or intermediate fibers, and these are the direction. So, if we talk about the anterior fibers, they are going in vertical direction, the posterior fibers are more directed horizontally, and the middle fibers are directed more oblique direction. So, these are the direction of temporalis muscle fibers. So, if you want, you can write it also. Temporalis muscle has got 3 fibers are there. Temporalis muscle has got 3 fibers. Anterior fibers are where is your mandible bone video, ma'am? Okay. So, I have not, Huda, I have not uploaded now, dear. If you want, we can upload it. So, I will try, okay. Fan shaped muscle. Fan shaped muscle. Okay, Huda, you want the video of mandible bone? So, yes, I will make one video of the osteology of the mandible bone, okay. If the students require, then I will make it. It is a fan shaped muscle and its anterior fibers are directed or oriented vertically. Its middle or intermediate fibers are oriented oblique direction, and its posterior, yes, okay. So, yes, and its posterior fibers are directed posterior fibers. So, we are talking about posterior fibers, okay. When we are talking about posterior fibers, so it is anterior, middle, and when we talk about posterior fibers, they are directed horizontal direction. They are directed in horizontal direction. Got it, everyone? Okay, sure, Huda. Now, after that, let us move on to the second muscle of this category, which is very important, the masseter muscle. Which muscle? The masseter muscle. Now, if you will see the masseter muscle, so if you will see, it is as a whole, the shape is quadrilateral. So, just outline this muscle. This is the masseter muscle, and as a whole, it is quadrilateral in shape. Okay, this is the masseter muscle, and as a whole, it is quadrilateral in shape. See here. So, what I have outlined is the masseter muscle. Masseter muscle, the word masseter means chew karna, chewer. Okay, so the word masseter means chewer. Okay, and what you can appreciate that the whole is shape is quadrilateral, which is quite clear here. The shape is quadrilateral, as you can see, and if you will see, actually the whole of masseter has got 3 layers of muscle fibers: superficial, deep and middle. It is having superficial, it is having deep, and it is having middle fibers. Superficial fibers are arising from the maxillary process of the temporal bone and basically from the anterior 2/3 of the inferior border of zygomatic bone. So this is the whole of the zygomatic bone which you are seeing. So the it is getting origin from this bone, that is the zygomatic bone, masseter muscle. And if you will see, the superficial fibers is from the anterior aspect, it's from the maxillary process of zygomatic bone and also from the anterior 2/3 of the zygomatic bone inferior aspect. And when you see the deeper part, so this few fibers are coming from the deeper aspect. So they are basically, when we talk about the deeper fibers, okay, deeper fibers, so deeper fibers are basically coming from the posterior one, so deeper fibers are coming from the deeper aspect of zygomatic bone, but the middle fibers are from the lower 1/3 of the zygomatic bone lower part, so lower posterior part. Okay, so means 3 zygomatic bone. If you don't remember so much detail, you can just tell zygomatic bone, that is also enough. But if you want to know more detail, it is having superficial fibers from maxillary process of zygomatic bone and from anterior 2/3 of the inferior border of zygomatic arch. The deeper fibers are from the deeper aspect of zygomatic bone, and from the middle fibers are from the lower aspect of zygomatic bone, but from posterior aspect, not the anterior aspect. So this is the whole origin part. And insertion, as you can tighten this also. Can you feel, if you are tightening, clenching your teeth and all, you can feel the tightness, and the whole quadrilateral muscle can be easily visible. And this is the muscle which is lying on the outer aspect of the ramus of mandible bone. So you can feel that tightness and the it's hard quadrilateral shaped muscle. So please write on that. So let's write the insertion and origin of masseter muscle. Origin of masseter muscle, so it originates from, it is having 3 origins. One is superficial fibers, the superficial fibers are originating from maxillary process of zygomatic bone, maxillary process of zygomatic bone, and anterior 2/3 of inferior border of zygomatic bone. This is about superficial fibers. Now coming to the deep fibers, the deep fibers of the masseter muscle is originating from the deeper aspect of zygomatic bone, and the middle fibers are originating from lower border of posterior 1/3 of zygomatic bone, posterior 1/3 of zygomatic bone. Thereafter, all these fibers intermingle and then insert collectively on the ramus of the mandible bone on the lateral or outer aspect. So, insertion, lateral aspect of ramus of mandible, lateral aspect of ramus of mandible. Got it? Nerve supply, Nerve supply is from masseter nerve, masseteric nerve. Nerve supply is from masseteric nerve, and this masseteric nerve is again the branch of anterior division of mandibular nerve. So, it is again the branch of anterior division of mandibular nerve. Masseteric nerve, and this masseteric nerve is a branch of anterior division of mandibular nerve. Action. When we talk about the action is it elevates the mandible, it elevates the mandible, that means closes the mouth. Masseter muscle elevates the mandible and is it's closing the mouth. It's closing the mouth. Now done. Let's move on to the next one. That is so now two other muscle which is very important. One is the lateral pterygoid and other is the medial pterygoid. So yes, let's move on to the lateral and medial pterygoid. So all of you are understanding? Please let me know. So two other muscle which is very important is the medial and lateral pterygoid. Okay. So here what happens, firstly I will explain the lateral pterygoid muscle and then the medial pterygoid muscle. In this diagram you can see the lateral pterygoid muscle is having two heads of origin. So let me slightly more enlarge it. Yeah. So it is having one, this is the upper head of origin and this is the lower head. Okay. So lateral pterygoid muscle is having two heads. This is the upper head or superior head. Yes, Huda? Okay, okay. Don't worry, I have noted your point and surely I will either go live or I will make a video and upload it in the coming give me a time of 2-3 days, and then I will upload the whole of the osteology of mandible along with all origin, insertion and important structures attached there along with the relation of nerve and artery. Okay, Huda? And this is the lower one. This is the lower. So upper and lower we can find it. So we are seeing the upper and the lower head of lateral pterygoid muscle. Okay. Now this upper head of the lateral pterygoid muscle, so let me concentrate on another diagram to make you more easily. So you just firstly try to understand this. See here. Okay. So here you can see the lateral pterygoid muscle, both the heads has been shown, okay, upper and the lower head, okay. So here the upper head is originating from infratemporal surface and the crest of greater wing of sphenoid. This is the upper head. This is the lower head, okay, and lower head is coming from the lateral aspect of the pterygoid plate, okay, lateral aspect of pterygoid plate. So in this diagram better is the insertion being seen. So the origin part, the before diagram I will see. Can you see here, this is which joint? This is TM joint. This is TM joint. So it is inserting towards TM joint. Actually the lateral pterygoid muscle, if you will see, it is going towards the TM joint and inserting into articular disc and fibrous capsule of TM joint. And also few fibers of it goes towards the pterygoid fovea. It's a small depressed area lying on the anterior aspect of in the mandible anterior border close to the ramus. So that is the pterygoid fovea. So let me show you this again. Okay, so just focus on the lateral pterygoid muscle only. So let me rub this once more. Yeah. So here this is the upper head and this is coming from, this is greater wing of sphenoid, this bone I am talking about, this is sphenoid bone. So it is originating from the infratemporal surface and the crest of greater wing of sphenoid. This part of the bone which you are seeing, this part of the bone which is seen here, actually this is originating from sphenoid bone, the upper head. When you will see this plate of the bone which you are seeing, a part of it is the lateral pterygoid plate. So from lateral aspect of lateral pterygoid, the lower head is originating. So this is L for lower head, this is U for upper head, and then inserting, if you will see, it is going towards the articular disc. So this is the articular disc of TM joint. Okay, so it merges with the articular disc of TM joint, also with the fibrous capsule, and here lies the pterygoid fovea. Here lies the pterygoid fovea. So all of you have understood. Let me write this point. All of you write on the heading lateral pterygoid muscle. Lateral pterygoid muscle. Lateral pterygoid muscle. Lateral pterygoid muscle is having two heads of origin. Upper head, which is also called as smaller head of origin. Upper head is smaller head of origin, and this is originating from infratemporal surface. This is originating from infratemporal surface and crest of greater wing of sphenoid bone, greater wing of sphenoid bone. Okay, upper head. Now coming to the lower head, that is the larger head. So lower or the larger head. So lower or the larger head is originating from lateral surface of lateral pterygoid plate. Lateral surface of lateral pterygoid plate. Done. And now coming to the insertion. The fibers are inserting into the lateral pterygoid muscle. Fibers are inserting into pterygoid fovea, lying in front of the neck of mandible. Exact location is lying in front of neck of mandible. And also attaches to articular disc and capsule of TM joint. Capsule or fibrous capsule of which joint? TM joint. Now one more point is important, that this is the one muscle which is causing depression of the mandible. So this is only one muscle which causes depression of the mandible. So write on action. Action. It depresses the mandible, causes side to side movement of the mandible. That means it is opening the mouth, side to side movement and protrusion of mandible. Now coming to the medial pterygoid. So the next muscle is the medial pterygoid. So firstly I would like to explain the thing in this diagram. So let's now focus on to the medial pterygoid muscle. So medial pterygoid muscle again has got two heads of origin. One is the deep head and the other is superficial head. So this part which you are seeing is the parts of the deep head which you are seeing. Okay, this is the part of the superficial head, and here few fibers which you are seeing is the deep head. So two heads can be seen, one is the superficial head and the other is deep head. When we talk about superficial head, the superficial head is originating from maxillary tuberosity. Okay, from the maxillary it's originating from the maxillary tuberosity, also few fibers from the pyramidal process of palatine bone. The deeper head is originating from lateral pterygoid plate, but if you talk about the deeper head of medial pterygoid, it is from the medial aspect of the lateral pterygoid plate. So lateral pterygoid plate is important bony prominence, very nicely seen on the skull bone base, and you can appreciate that it is having one lateral aspect, another is medial aspects. From the medial aspect, the medial pterygoid muscle, and from the lateral aspect of it, the lateral pterygoid muscle originates. And here in this diagram you can appreciate, so let me just remove this. Now see this diagram. Here what you can appreciate, that the part of mandible bone has been removed. So you can see here the part of mandible bone has been cutted. Why? To show you that these fibers of medial pterygoid muscle is going towards the ramus of mandible, but my dear friends, here it is going towards the ramus of mandible on the medial aspect. It is inserting onto the medial aspect. Got it? So let's start with the medial pterygoid muscle. Here also in this diagram you can appreciate the two heads of the medial pterygoid muscle is as the ramus part of the mandible has been cutted out, dissected, and these two parts, so one is originating from the maxilla bone, maxillary tuberosity, this is the maxillary part of maxillary tuberosity. The other which is coming from deeper aspect, that is this is the deep part D, and this is the superficial part, that is coming from medial aspect of lateral pterygoid plate. So yes, now let's write the details. Okay, so please write down the name medial pterygoid muscle. Medial pterygoid muscle. Medial pterygoid muscle. Medial pterygoid muscle is having small superficial head, this small superficial head is originating from infratemporal surface, crest of greater wing of sphenoid, infratemporal. Okay, we will move on to, we are going towards the medial pterygoid, okay, not on the lateral, we have already done lateral pterygoid. Okay, so please note down, sorry, this is from maxillary tuberosity. So we can remember like this, M for medial, M for maxillary tuberosity, M for medial aspect. So how you can remember the medial pterygoid muscle origin? M for maxillary tuberosity, M for medial aspect of lateral pterygoid plate. So like this, so small superficial head of the medial pterygoid muscle, it originates from maxillary tuberosity, it originates from maxillary tuberosity, and also from pyramidal process of palatine bone. The large deep head is originating from medial aspect of lateral pterygoid plate. Medial aspect of lateral pterygoid plate. Got it? Done. Action and nerve supply. So, actually this is the one muscle, that is medial pterygoid muscle, which is getting innervation from the trunk of mandibular bone. So, from the trunk of mandibular nerve, there is a nerve branch which is called as nerve to medial pterygoid, and this nerve to medial pterygoid is a branch of main trunk of mandibular nerve. Lateral pterygoid muscle is getting innervation from, again, branch from the anterior division of mandibular nerve. So, I think both nerve supply you have to write. We have already written the lateral pterygoid muscle action, but here write down medial pterygoid muscle. Medial pterygoid muscle is its origin insertion done. Now the nerve supply. Lateral pterygoid muscle. Lateral pterygoid muscle from the branch of anterior division of mandibular nerve, and when we are talking about medial pterygoid muscle, it's the branch from trunk of mandibular nerve, and the name of that nerve is nerve to medial pterygoid, nerve to medial pterygoid. Okay, in one line it is okay that all is getting innervation from medial, all is getting innervation from mandibular nerve, but basically sometimes it is asked like this also, which of the following mastication muscle is getting innervation from trunk of mandibular nerve, then the answer is from the trunk medial pterygoid muscle. Action. When we talk about the action of medial pterygoid muscle, so medial pterygoid muscle is again causing elevation of mandible, causing protrusion of mandible and side to side movement of the mandible. It helps in chewing action, side to side movement of the mandible. So actually all the muscles is causing elevation of the mandible except the one, that is lateral pterygoid. Lateral pterygoid muscle is causing depression of mandible. So I think I have written that fact also. See here, it's the lateral pterygoid muscle is only causing depression of the mandible. So we have done this point. So with this we have finished the action, origin, insertion of all the muscles of mastication. We have finished the medial, lateral, masseter and temporalis muscle. So before ending the session, I would like to tell that you can use my code ANAT10 for unlocking free sessions on the Unacademy platform, and you can see my free sessions. So today in the 9 p.m. on the Unacademy platform, I am taking free sessions, MCQ session. So you can be the part of this session. These are my sessions details. So today in the evening 7:30 p.m. I am taking the MCQ session. Again, high yield anatomy MCQ session. 2 sessions are going on, one at 7:30 p.m. the other on 9 p.m. So you can attend this. For this you can use the code ANAT10, and those who want to take the subscription of Unacademy, they can use the code ANAT10 for 10% discount, and they can go through the details. I have included the slide of details of the Iconic subscription and NEET PG subscription of Unacademy. Again, for that you can use the code ANAT10. So you can use the code ANAT10, and you can join my Telegram group for the latest updates about anatomy, and also the links of all my free sessions is shared there. Monalisa Anatomy is my Telegram group. All the best, keep studying. Thank you so much. Any doubt? Can I end the session now? Let me know. Okay. So if any doubt, you can type it, otherwise I am just ending the topic. Okay, that's the muscles of mastication. 4 muscles in detail we have studied. Yeah, thank you so much.